anterior because instead of having one precava, it has two. It has a right precava and a left precava, which is weird. And the right atrium actually has three openings. It has an opening for a right precava, a left precava, and a post cava. Usually there's only two openings. Okay, so if we're draining the head of the animal, I'm going to start here on the outside. And what you'll find is that you can't see it very well here, but there's a V-shaped split. It's not even there on that one. Yeah. Can I use your bunny for a second? I want to find the split. Thank you.
Oh my God.
Yeah,
Small,
I know.
medium, large.
Gigantic. Okay. Let's see. I don't even know if they have one. It's got a nice internal jugular. Oh, there it is. Okay. We might have to get my bunny out. Not very well injected either. Okay, so it kind of loses its injection, but you can see the vessels are really huge.
That V right there?
Yeah.
Yeah.
See this V right here?
Yeah.
Rebecca?
Yeah, I see it now. It is
You
now.
see that? Okay, so the V has blood coming from like the medial surface of the chin right here, and then from back behind the ear. So this vein right here is called the anterior facial vein, and this is the posterior facial vein. So the one that's coming from behind the ear is the posterior. The one that's coming from the front, the chin, is the anterior. And both of them dump into, look at this big vein right here on the side of the neck. That's the jugular vein. And you'll notice that the external jugular vein, it's called the external jugular vein. The external jugular vein enters the thoracic cavity. Look at, well, I'm going to show it up. All right, so it enters the thoracic cavity right here. So look at external jugular vein, external jugular vein. Okay, and that vein, the external jugular vein, is joined medially by the internal jugular vein, this small one. A lot of times that's not injected very well, so it may be hard to find. Well, if it's not injected at all, then it's going to be kind of hard to find. Virtually impossible. And then you'll have joining into this external jugular vein is your subclavian vein, and that's going to come from whatever arm you have. So let me dig it up here. I can't see it. I'm having so much trouble with my subclavian veins today. There's this one. Okay, you can follow it from the arm. And it's usually pretty sizable, but these didn't inject really well. But coming from the arm, you're going to have this subclavian vein. I see part of it right here. Okay, so the subclavian vein, and it lost it. Look at that. It's right here. So weaning without injection. The subclavian vein joins in with the external jugular. So here, look at anterior facial vein, posterior facial vein, into the external jugular. External jugular is joined by the internal jugular, the left subclavian, and then it drains. Oh, wait, there's this small vein that's coming from, see the chest wall here? This one's a little more injected right here. that joins into this external jugular vein, which by the time your internal and this internal mammary vein, your internal jugular, internal mammary vein, and your subclavian join into the external jugular, it then becomes the left precava on this side. So your right precava will have the same things, not as visible on this side, but I can see here this
Internal
right
jugular.
internal jugular. I can see the right subclavian right here. See that? Right internal mammary. And here is the right precava. All right, so now if you take all of the lung and the heart and you peel it over from the right to the left, you're going to see that there's a vein running up the center toward the right precava. See, you can see it dumping into the right precava right here. Okay? And then you can see all these blue vessels from the ribs running into this big vein. So these are the intercostal veins, and they're dumping into this vein over here that's only on the right side of the thoracic cavity. This is called the azygous vein. Azygous means without a twin. Okay, so if I peeled the organs over here, look at, there's nothing over here. Okay? All right, so that's draining the head. You have anterior and posterior facial veins dumping into the external jugular. External jugular is joined by the internal jugular, the subclavian, internal mammary into the precava. On the right side, we have the same thing. However, the intercostal veins dump into the azygous vein, which dumps into the precava, which goes into the right atrium. Okay? And now, if we lift up the heart, remember this, the mediastinum here that's dividing the thoracic cavity into right and left halves? That is also surrounding this, which is the postcava. Okay, and the postcava goes all the way back down to our thoracic or our abdominal cavity. So finding the postcava, especially when the latex explodes, is a little bit of a task, but you'll be able to find it, and you'll be able to see that there are branches coming in from certain landmarks. All right, so the first big branch that I see here coming in that I can identify easily, it's not the first branch, but it's one of them, is this big one here. See how it's going out to the kidney, or coming from the kidney, I should say. Okay, so veins come from organs back to the heart. This is the renal vein. See, they're what do you call that? Asymmetric. Now, if I look just anterior to that, there should be another vein. Usually it comes off separately from or joins into the postcava separately, but look at this one is joining into the renal vein, and then they're joining into the postcava. You're supposed to have two separate. And on this side,
What was that one called?
this is called the adrenolumbar vein. So look at, here's the adrenal gland right here, just anterior to the kidney. And so this continues on into the lumbar vertebra. All right, so here, look at, here's my postcava, here's this renal vein. Look at, this one has a separate adrenolumbar vein coming right off of the postcava, or going into the postcava. All right, so peeling through here, our next split should be the gonadal vein. So this is a male, and so what we can do is we can kind of cheat and find where the spermatic cord comes into the abdominal cavity. So look at, I can see, here's one of the testes right here. I think that's the left one. The right one right here, so you can see, yep, that's the right one. There's the left one. All right, so here's the spermatic cord. The spermatic cord contains the vas deferens, the testicular vein, and the testicular artery. Okay, so look at, I can see on the spermatic cord, I find the blue, and I know that's the testicular vein. So I'm going to follow it. It's teeny tiny. It's going to dump into my post cava. That's underneath here. So you'll have to do some scraping of connective tissue so you can reveal these veins and arteries. But you can see this right testicular vein here. It's joining into the post cava right here. Okay, and then, so we see that spermatic cord there. If we start digging through this connective tissue down by the legs here, we can see that the arteries and veins will split, to feed the legs. They shouldn't be that delicate. Okay, and just like on your little paper there, what happens is that these veins and these arteries kind of make a chevron pattern, and it'll look kind of like, let me show you first. Okay, so draining the leg, we have, here, let's just, okay, there. So draining the leg, on the leg in the medial surface, that's the femoral or femoral vein, okay? And it enters, once it passes the abdominal body wall here, it enters into the abdominal cavity. See that right there? Okay? That is called the external iliac vein.
Oh, so it's the same vessel.
Wait, it's the same vein.
It's the same vein. When it crosses the abdominal plane, it changes name. Okay? So when it's out on the leg, it's called the femoral vein. When it is inside the cavity, it's called the external iliac vein. Okay? So I don't want to break this. It's not real easy to see. All right. So now I forgot to show you guys, just anterior to that is another split. So let me just remove this. Okay, so we have, here's our post cava, right? And then, yeah, the big thing in the middle. And then look at, I have my testicular vein coming from, or going into the post cava here. And then look, there's two veins. Sorry. Oh, I just ripped that, sorry. So I'm going to pick up the post cava. So there's two veins that go out to the side. See those right here? Those are the iliolumbar veins. So they're feeding the lower lumbar vertebra. And then we have our two external iliacs right here. Darn it, it's not very easy to see. Do you guys have? Oh yeah, you guys had the good one. All right, this is so disgusting. Smells a little rotten. Okay, so look at, here's your renal vein. Oh yeah, that's nice. Look at, it's a separate, completely separate, right here. Adrenolumbar, renal, gonadal. This is a female, so it's an ovarian vein. Oops, I broke it. Shit. Sorry. But look at this. Look at how weird that is. It's completely split.
Wait, what?
That's so weird.
So
This right here is the post cava.
Okay.
Look at this. This is weird. I don't know.
Post Cava 2.0.
Post cava part 2.
Probably. Because look at, here's your other ovarian vein. Right here. So this is weird. Look at that. So weird.
It looks like almost trisect.
Yeah.
Can that happen?
It can happen. None of these vessels are going to be the same. So that's why it's so important to know your landmarks. Okay, so look at, just clearing this away. So right here, this area looks like it's posterior mesenteric artery. But we're not going to know that. Look at this too. There's another one. Weird. Weird, weird. Alright, so oh my god, this is so weird because, like, look at it, doesn't have iliolumbar. Doesn't have an iliolumbar vein. Maybe these are serving as their iliolumbar veins. I don't know. That's weird. Okay, so what I want you guys to notice though is that you should have two here. So coming from the tail. Let's come from the tail. In the middle, okay, so going from the tail, see this middle clumpy? That's the caudal vein. Okay, and just anterior to that, you're going to have a blue vein, a pair of blue veins that's joining it. This is the weirdest rabbit I've ever seen in my life. Okay, so here's one side coming from here, and here's the other side.
That's
Internal iliac veins. Here's your external iliac, this one right here. And if you follow it, it continues on to the femur.
so in an exam, how would we differentiate external versus internal?
You can see the difference. Not on this one, but you can see the difference. I'll show you on my bunny. Because it looks like this, all right? So you have, here's your caudal vein, external iliac.
Coming from that just crossed the
That's coming
abdominal
from the femur
wall. Yeah.
across the abdominal wall, so it's external iliac. If this was where the abdominal wall was, these would be the femoral veins. Here's your internal iliacs, and then the caudal vein. Okay? So it looks like a pair of chevrons. All right. Again, weird. Okay, so here is the left external iliac. Here's the right external iliac. Look at this one's got a weird branch on it too. This is fucked up. Funny. All right, so here they're joining into the post cava. This could be an iliolumbar vein. Doesn't look like it. It should be right here. So you should be having an iliolumbar vein right here. It's gonna look just like your picture, but this one's really weird.
So it just went up and left.
Yeah,
And then we have now 2 post cavas basically.
3 post cavas. Look,
Post cavas.
I don't know where that came from. They're both branching into the renal veins.
So if this happened to be an advantageous mutation, this is what would drive evolution.
If it reproduced, but it's not gonna. It's kind of not reproductive right now.
It's off the market.
Yeah.
Maybe.
All right, so look at, I'm going to show you guys this. See back here, can you kind of really see in there? There's a pink line that's, see right here? Okay, that's your caudal artery. That's going to feed from our dorsal aorta into the tail. Okay, so a lot of our arteries are going to follow where our veins are. So starting from the top. Oh, this is frustrating. Okay, so the hard part is digging out all of these arteries. And sometimes following them from the head region, well, I don't know on this one if it's going to do any good. It might. I have moderate faith.
I'm just getting used to disappointment with this rabbit.
I know. I wish there were like enough rabbits for everybody that are injected well.
Noticing a trend there with
Ugh.
that too.
Yeah. They're either rotten or injected or both, or not injected well or both. Okay, so the first thing I want you guys to do is I want you to look at the heart and remember when you opened it up, you saw, look how thick the left ventricle is compared to the right ventricle walls. Okay, so from the right ventricle, we know that blood is being pumped to the lungs to be oxygenated, and it's being done through, look at this big vessel right here. This huge thing, that is the pulmonary artery. And then just anterior to that is going to be the arch of the aorta. Okay, so you have the arch of the aorta that's coming. Oh my God, this one is so weird.
So is the pulmonary artery not labeled in this one?
It's right here. It's not labeled, but it's on there.
Gotcha.
Okay, so here's your arch of the aorta right here. It's coming off just posterior to that pulmonary artery. So the arch of the aorta twists around here. I'm going to break this because it's mostly thymus gland. So you look at, you can see the arch right here?
Oh, much better.
Yeah, much better. Okay, and so connecting the arch of the aorta to our pulmonary artery here is this ligament. Okay, it's kind of covered in your guys's with a bunch of schmutz, but there's a ligament covering that. That's called the ligamentum arteriosus, and it's a closed fetal vessel. From when this was a fetus, because it's not oxygenating blood in its lungs, it's getting the oxygen it needs from its mom, it diverts blood flow to the lungs through a vessel called the ductus arteriosus. And upon birth, it closes up and it becomes the ligamentum arteriosus. So that's an important thing to know. And what we have here is there are usually 3 different conduits or openings from the arch of the aorta that feed vessels that are moving anteriorly. This one is just terrible. You know what? I'm not gonna try. Yours doesn't even have arteries, right? This one. Well, it does. I can see them, but there's like so much crap.
I'm not surprised anymore.
Can somebody grab my bunny, please? The one that still has the fur on it. The bunny's terrible.
The shark was like that too.
Oh, it's so fucking frustrating.
Is this one of those you had one job moments?
Yes. Thank you. I didn't even defer this one. My other one doesn't have any veins injected. Look at how pretty this is. Ugh. All right. Look at, we can identify all those veins, right? Look at here.
Oh.
Oh man, that's nice. Look at that. Anterior facial vein, posterior facial vein into the external jugular. Look at that, external jugular. And look at this gigantic subclavian vein. Look at that. Here's the internal jugular, internal mammary, right precava. Look at this gigantic azygous vein. Remember azygous without a twin? Okay, and on the same, look at this one. It's so nice. Anterior, posterior, external jugular. It doesn't have too bad. Look at, here's the internal jugular right here. It's tiny. Subclavian, internal mammary.
Wait, is there a transverse?
No, not, see, it didn't inject very well. But it's gonna be, if you see one, it's like right across here. Usually, like in the cat, it's on top of the neck. So bunnies are just weird. Okay, so look. Here is our arch of the aorta right here.
Mm-hmm.
See how nice that is? Here's our pulmonary artery. I can dig, oh my God, that's huge. Look at that. Ligamentum arteriosus. Huge. Okay, look at, I have, it looks like only 2, but there should be 3. 1, 2, 3 branches off the arch of the aorta. This first branch here is called the
Common?
brachiocephalic trunk artery. And it gives way to the first branch here, which is the right common carotid artery.
Mm-hmm.
Okay? And then it continues on to the arm in the right subclavian artery. Branching off from the right subclavian artery, first anteriorly, is the vertebral artery. And then this one branching off and following, look at how it follows here, this external jugular vein. This is the thyrocervical trunk artery. Okay, and then we go into the right subclavian. If we look posteriorly, okay, I see 2 branches right here. This first branch that's turning toward the medial side, this is the costocervical trunk artery. And then look, there's one going, following the internal mammary vein to the chest cavity wall. That is the right internal mammary artery. Okay, so right common carotid, subclavian, vertebral, thyrocervical trunk. Then we have our costocervical trunk artery, internal mammary artery, and then continue on into the right subclavian. The next hole off of the arch of the aorta will be simply for the left common carotid artery. Okay, but look at, this has anastomose together, so it looks like one branch. This would be a true innominate artery, but it should be 2 separate branches. Okay, so this third branch off the arch of the aorta is the left subclavian artery. And the left subclavian has all the same branches as the right subclavian. So if we go and look at the anterior, the first branch off is the vertebral. The second branch here is the thyrocervical trunk. The main thing continues on into the arm, which would be the left subclavian artery. And then we have these 2 branches here. Okay, I think I broke the costocervical trunk. But, oh no, there it is. Costocervical trunk artery bends into the medial area, and then this internal oh, I think I got it mixed up. Okay, here's the internal mammary. The costocervical trunk dumps into the medial vertebral area. Okay, so 3 branches, brachiocephalic trunk, left common carotid, and left subclavian. And then the arch of the aorta, look at this, it turns down along the thoracic medial thoracic area. We can call this part of the dorsal aorta the thoracic aorta. And see all these little pink branches coming off from it? Those are the intercostal arteries. Those are serving all of the rib muscles. Okay, so remember on this side, we had all the intercostal veins joining into the azygous vein. All right, so if I follow my thoracic aorta past the diaphragm, it becomes the abdominal aorta, still the dorsal aorta. So because we ripped all of the digestive tract out, we'd be able to see this one branch here. This is called the celiac trunk artery. Okay, we probably won't be able to see the next branch. That's the anterior mesenteric artery, but I think we probably took it out with the, so let's not be responsible for the celiac trunk and the anterior mesenteric or the posterior mesenteric. But look at, from my dorsal aorta here, see how it kind of follows my post cava. I can see a first branch out here to my adrenal gland in these lumbar, anterior lumbar areas, adrenal lumbar artery, renal artery. Here's my post cava. Look at, here's the next branch off. This would be the testicular artery in this guy, and we can follow it down here. Indeed, see, it dips into the testes right here. Okay, so it becomes part of the spermatic cord. Here we see the dorsal aorta kind of split into two directions. See the major split, and then coming off of that split, we have these iliolumbar arteries. Look at, remember when we were trying to find the iliolumbar veins on your guys' one? It was lame. Mine's nice. All right, so see that? Iliolumbar arteries, these big V's right here are your external iliac arteries. They continue on, look at, into the femoral artery. See? That's really nice. Okay, and then if we look internally, we'll see that there are two vessels coming off more medially in a V. Those are your internal iliac arteries. So here's one right here. Here's another one, I think. I'll grab at something. Here it is, right here. And then there's one artery going toward the tail, and that's the caudal artery. Okay, so the best thing to do is know your landmarks, because yours is weird. Yours doesn't have any latex in it, and mine's perfect. But you guys can